Going now? Okay. We're visiting today with Dr. William Ray, who is the founder of the Environmental Health Center of Dallas. And Dr. Ray is one of the pioneers in treating and diagnosing environmental medicine. And Dr. Ray, could you maybe in layman's term just briefly say what environmental illness is?
Well, yeah, environmental illness is the effects of the environment on the individual to the point where they can't function, or they get reactions to things and they don't function properly.
Right. Now, Dr. Ray, there's a lot of debate today about GMOs, whether they're good for us, bad for us. I was just last year was in a forum where they were talking about some of these issues, and had a man, a geneticist, say that no one had ever died from eating GMO foods. And while that may be the case, the same could be said for smoking, that no one's actually died from smoking a cigarette. However, there have been millions of people die from the effects of it. Now, in your practice, do you feel that you've seen folks that have actually died from the effects of some of the chemicals that we use and a result of the GMOs that we're doing today?
Well, we don't know whether they have died yet, because some of them have only been used recently, okay?
Right.
And so, but we've seen a lot of people being made sick and incapacitated, and I guess it depends on your philosophy of what's worse, whether it's worse to be years of incapacitation or to die.
Right.
You know, and that's one of the problems. The other problem is that of course the technology until recently has not been there, and so people can say anything they want, and it may not mean anything because of the fact that the technology of measuring it in the human has just come about in the last few months.
Right.
And so we are totally against these GMO foods, and the reason we are is because they're so devastating in the animal studies and in the other studies, number one, and number two, we've seen too many people being sick by it and incapacitated, and to me that's just awful.
Right. And I know in our experience when we talk with people about it, and they say, well, I've never heard of environmental illness, or I've never seen that, and why do you think that is?
Well, I think it's been slow to drift down to the public, although we've been talking about it and writing about it for about 30 years. And I think now the general public realizes that there is such a thing as chemical sensitivity. Right. And they may not relate that to themselves, but you know, do any of them get arthritis, or do any of them get colitis? Do any of them have chronic headaches? Do they get confused at times? Do any of them have heart irregularities? Anybody have bladder problems, or problems with getting pregnant, or birthing bad babies and this? Well, the answer is sure. They've all seen it. Right. The thing is, it just hasn't been put out to them to look for the cause.
Okay. And also, in your experience too, I know you deal with some of the most severely chemical sensitive patients. Part of the problem is because that, isn't it because this illness incapacitates so many of these people where they can't be out in society?
Yes.
With people, so that people don't see them because they can't be around
That's right. A lot of them get confined to their house, and of course this is very devastating to these people, and yet they can't communicate on the what's so-called outside world because of that.
Right. And I know you visited me one time that a person usually contracted this illness in one of two ways. What is that?
Well, either by breathing the substances, and that means also not only the lungs, but going right up the nose into the brain, because our nose is the probe for the brain, you see. And the other thing is, of course, is some things can be absorbed also. And our number one offenders are pesticides and herbicides, and number two, tied for that, is natural gas.
Okay.
And so, so those would be the two major things, but you can go down the line like formaldehydes and phenols and various other paints and so on in the houses can cause these problems also.
Well, I know that about the reason for the GMO crops that we are hearing today, about 85% of it is so that these crops can facilitate the spraying of glyphosate on the crop, and then the other 15% is so, or a lot of the other 15% is for insecticides used with like the BT corn and some of those things. But it results of the glyphosate. I know is you've seen a lot, and like you said, most number one offender is pesticides and chemicals.
That's right.
And what this happens is just a sudden death, a sudden exposure. Or is it a long-term thing? I know.
Well, that's an interesting phenomenon. We've seen both. We've seen one hit and person gets ill, you know, and then we've seen the other side where a person gets exposed to this year in, year out, and then suddenly they can't tolerate odors of any things anymore, or suddenly they come down with asthma or heart irregularities or arthritis or swelling, something like that.
And would you say, like I said, the majority of your patients over the years, and maybe you have some idea about how many patients you've seen over the years you've been in business, but that the majority of them, it was a result of maybe a lifetime exposure, a low-level exposure to chemicals of some sort, either farm chemicals or other industrial type chemicals?
Yes, or a series of exposure. For example, we've learned that people who get knocked out or get a real blow to the head, you know, when they're a kid, they fall down or they get knocked out, or they're playing football, or, you know, whatever, and then that heals. But that always is an itis for the chemicals to blight on the people, and they can then get exposed to some pesticide or some natural gas product, and bang, they're in trouble. And we've seen about 30,000 of these patients now, and it's all over planet Earth.
So, in your professional opinion, would you be in agreement that at the least we need to revisit really the whole GMO what do you call it, phenomenon, or what, as far as its really safety in the food industry?
Well, I think that there's enough evidence that we don't need to revisit it. We need to eliminate it.
Well, we appreciate your time, Dr. Ray, and we appreciate all that you are trying to do for the chemically ill people. So
Anytime.
thank you so much.
Maybe that's a little strong.
Okay.